Hello guys, I wanted to do a follow-up video on this particular case. I know a lot of you guys have been interested in, and we finally have the answer on this ultrasound images here. I'm going to be playing it in a loop. I'm going to be giving a recap here on the case for those of that are seeing this video for the first time. Patient originally came into my office complaining about medial aspect elbow pain, pretty standard, typical sports medicine consultation. Patient had traditional symptoms of golfer shuffle with medial epicondylitis, had been treating in the past by another provider, didn't get better. Everything is straightforward until she tells me, Doc, I also have this mass about 2 inches proximal to the medial epicondyle. I'm not sure what it is. I had it for 2 months. Could this be related? Not related to that, but let me take a look at it. And we saw this. When I scanned it with my high resolution ultrasounds, I see this mass, this hypoechoic circular mass with these hyperechoic lines that were essentially moving. Okay, here you guys could take a look at it. I've never seen something like this. I posted it in LinkedIn, and thank you guys to everyone that social media can sometimes definitely work in the medical community, because a lot of comments, including a couple of people that said this looks like filariasis worm, causes elephantitis, very common in undeveloped countries, almost no cases reported in the United States, but it looked just typical to that. I did a little research. It looked like the treatment was surgical excision, so I took her to the operating room. Before I did that, I involved my pathology department, my infectious disease department, just because, I told them this could be something that's kind of unique. We took her in. On the ultrasound, I was able to do a local excision. I took out the whole mass without disrupting. I definitely did not want to cut into it and spread whatever was in there. The pathologist initially evaluated, and she said, hey, there was nothing in there. It was just a bunch of pus, and that's what it looked like when I took it out. But nothing grew. But because there was a concern for a possible, filariasis or something weird, it got sent to the CDC, where it took 4 weeks for them to do their full analysis, including PCR analysis, and it came back positive for filariasis. So this is a very interesting case, not a standard case that I'm typically posting or commenting on sports medicine or regenerative orthopedics, but something that's definitely musculoskeletal ultrasound helped us distinguish. Patient is extremely thankful, not only to me, but everyone that commented, because again, I would have never gotten this diagnosis if it wasn't for you. Patient is doing awesome now. I did have her follow up with infectious disease, because I'm not sure if something else needs to be done from a systemic standpoint, but as far as I know, everything is doing well. And again, look at the images. Because if you ever encounter this, again, this is in the United States. This is probably one of the first cases, if not the first, of filariasis documented in the United States. But that's what it looked like, and this is what it looked like when we took it out. It's actually just a mass. And the true diagnosis, the hospital system won't be able to get it. You have to send it to the CDC for special staining and analysis with